Are you really ready for your next Medicare secondary payer audit, or are you just hoping for the best? Because hope is not a strategy when millions are on the line. The regulatory landscape is tightening, and today we're not just discussing compliance, we're giving you the actionable blueprint to confidently navigate audits, protect your bottom line, and stay ahead of the curve. Welcome to Medicare Secondary Payer Audit Fundamentals. What if I told you that mastering one of the most complex yet critical areas in healthcare finance, Medicare secondary payer and its audit fundamentals, is not just achievable, but absolutely essential for safeguarding your organization's revenue? For many, the words Medicare secondary payer or audit conjure images of tangled regulations, endless paperwork, and potential financial risk. And honestly, when you look at this visual, it's a pretty good representation of how MSP can feel. Think of these flowing, interconnected lines not just as a design element, but as the intricate pathways, the numerous regulations, the different payer scenarios, and the various audit triggers that define the MSP landscape. They all stem from a core concept, but they branch out, intersect, and sometimes even loop back, creating what often feels like an overwhelming labyrinth. Our mission today, as we dive into Mastering MSP, is to give you the clarity, the strategies, and the confidence to navigate this seemingly complex system. We're going to demystify these fundamentals, ensuring you understand not just what the rules are, but why they matter, and critically, how to apply them effectively to protect your organization and optimize your processes. So let's untangle these lines and turn potential headaches into clear, actionable understanding. Ever felt like you're navigating a complex maze when it comes to Medicare auditing, or wished you had a crystal clear roadmap to mastery? Well, you're in the right place, because today we're cutting through the noise and equipping you with the fundamental understanding and practical skills you need to excel. We're going to break down this powerful training into 3 critical pillars, ensuring that by the time we're done, you'll not just understand, but truly master Medicare auditing. First, we tackle the why. This isn't just about memorizing rules, it's about understanding the core principles of Medicare Secondary Payer, or MSP. We'll illuminate why these principles are so absolutely critical for ensuring correct payer responsibility, giving you that foundational insight to confidently make decisions. Once we have that solid why, we move to the what. Here, we'll dive deep into defining the key terminology that often trips people up. More importantly, we'll teach you how to interpret the most vital data fields in Tracker, empowering you to read between the lines and extract the exact information you need. And finally, knowledge isn't enough without action, which brings us to the how. This is where we bring it all together. You'll learn to execute the fundamental Medicare audit workflow not just accurately, but with unwavering precision. We'll walk you through the steps, ensuring you can apply everything you've learned to real-world scenarios. By the end of this session, you'll have the complete picture, the reasoning, the language, and the precise steps to navigate Medicare auditing like a seasoned pro. Let's get started. Have you ever stared at a medical bill, scratching your head, and thought, who is actually supposed to pay for this? Or worse, received a denial because the wrong payer was billed first? That moment of confusion, that pain point, is precisely what Medicare Secondary Payer, or MSP, is designed to resolve. The core question, the absolute heart of the matter, is right there at the top of our diagram. Who pays first? This isn't just bureaucratic jargon, it's about federal guidelines that dictate whether Medicare steps up as the primary payer or if another health plan, like your employer's group health plan, takes that initial responsibility. Getting this right saves time, money, and a whole lot of frustration. As you can see, the path splits into 2 clear outcomes. Either Medicare pays primary or the other plan pays primary. But how do we arrive at that crucial decision? It's not a coin toss. It's driven by 3 key factors, the pillars of MSP that you absolutely need to understand. First, we look at the Medicare entitlement reason. Why is this individual even eligible for Medicare? Is it because of age, disability, or perhaps end-stage renal disease? The reason for Medicare entitlement often sets the stage for its payment decision.
Second, we consider the employer group size. This is a massive determinant. Rules can vary significantly based on whether the employer has 20 or more employees or if they're a smaller organization. This difference can completely flip who pays first. And finally, the member's working status. Is the individual actively employed? Are they retired? What about their spouse's employment? Your work situation or that of your spouse dramatically influences where Medicare fits into the payment hierarchy. These three factors, the reason for Medicare, the size of the employer, and the individual's working status, are the fundamental drivers behind whether Medicare or another plan pays first. Understanding them is your key to unlocking the puzzle of MSP, ensuring proper claims processing, and ultimately avoiding those dreaded billing headaches. This isn't just a rule book, it's a guide to financial clarity in healthcare. Ever feel like you need a Rosetta Stone just to understand your health insurance? You're not alone. The healthcare world has its own unique language, and mastering it is your first step to truly navigating your benefits with confidence. On this slide, we're demystifying the core terminology around coverage types and relationships. First, let's look at plan types on the left. This isn't just jargon, it tells us how you obtained your coverage, which impacts everything from your premiums to your benefit structure. You'll primarily encounter three categories. GHP, or group health plans, often represented by the building icon. This is commercial coverage typically provided by an employer. If you work for a company that offers health benefits, this is likely what you have. Then we have non-GHPs. This means coverage not provided by an employer. Think of vital programs like Medicaid or Medicare Advantage. These are government-sponsored or privately administered plans outside of employer groups. And finally, the individual or marketplace plans, symbolized by the person icon. This is coverage you purchase privately, directly as an individual, often through state or federal exchanges. Understanding which bucket your plan falls into is foundational. Now, let's shift to relationships on the right. This defines who is covered under that plan. When you're dealing with claims or benefits, these terms are critical. At the top of the hierarchy is the subscriber or sub. This is the primary policyholder, the individual whose employment or status is the basis for the insurance coverage. From the subscriber, the coverage extends to others. You'll see coverage for a spouse and children. These are the family members covered under the subscriber's policy. And that brings us to the umbrella term dependent or DEP. This is a general term encompassing any individual, a child or a spouse, who is covered by the policy because of their relationship to the subscriber. By grasping these basic plan types and relationship terms, you're not just learning definitions, you're gaining the ability to accurately complete forms, understand benefit summaries, and communicate effectively about your healthcare coverage. This is essential for ensuring your claims are processed correctly and that everyone in your family gets the care they need. Have you ever felt like you're chasing shadows in your claims recovery efforts, knowing there's money out there but just out of reach? What if I told you there are two critical, often overlooked forces that define your exact window to act on those claims? Welcome to the world of scope and lag, your genuine window of opportunity. These aren't just technical terms, they are the fundamental guardrails that dictate your ability to recover revenue. Let's look at this timeline. You can see we're auditing on 10/1/24. Now, everything we talk about revolves around this current date. First, we have scope, also known as the look-back period. This answers a crucial question. How far back in time can we actually recover a claim? For instance, if your scope is 1 year and you're auditing today on October 1st, 2024, you can only pursue claims with a service date between October 1st, 2023 and October 1st, 2024. This defines the earliest possible service date you can touch, ensuring you're not going too far into the past. Then there's lag, our waiting period, often around 90 days. This isn't about service dates. It's about how long you must wait after a claim is paid before you can submit it for recovery. So, still auditing on 10/1/24, if your lag is 90 days, you can only work on claims that were paid on or before July 3rd, 2024. This sets the latest possible paid date you can touch, ensuring the claim has fully settled and isn't still in active processing. Think of it this way. Scope gives you the historical depth, while lag ensures the claim has matured. Your true window of opportunity isn't just one or the other. It's the intersection where both of these conditions are met. Understanding both scope and lag is paramount. It's what moves you from chasing shadows to strategically targeting your most recoverable claims within the defined parameters. Master these and you master your recovery potential.
How many of you have ever felt a little overwhelmed trying to figure out the difference between Medicare Part A and Part B? You're definitely not alone. It can feel like deciphering two different languages, but today we're going to make it crystal clear because understanding these distinctions is crucial for managing your healthcare journey. Let's start on the left with Medicare Part A, hospital insurance. See that clear, unmistakable icon of a hospital? That's your primary visual cue. Think of Part A as covering the big, foundational costs associated with serious medical events. This is your safety net for inpatient care if you're formally admitted to a hospital, for skilled nursing facility care after a qualifying hospital stay, and even for hospice care. These are typically costs incurred when you're staying in a medical facility. Now, shift your gaze to the right, to Medicare Part B, medical insurance. The stethoscope here perfectly symbolizes what Part B is all about, your doctor. This part covers the services you receive outside of a hospital admission. We're talking about all those essential doctor services, your regular checkups, specialist visits, diagnostic tests, outpatient care like day surgeries, and even necessary medical supplies. It's for when you're not admitted but still need vital medical attention. And this is where it all comes together for your tracking in the Spend Since Medicare tracker. We understand that while Part A and Part B cover different aspects, they both contribute to your overall healthcare costs. That's why, as indicated by the plus sign and the arrow, your Spend Since Medicare in our tracker is a cumulative total of both your Part A and Part B spend. This gives you one clear, comprehensive number, allowing you to easily monitor your entire Medicare-covered health expenditure. No need to track separate buckets. We've combined them for a holistic view of your financial journey.
Think about the sheer volume of data you encounter daily. It's often overwhelming, right? But what if I told you that within that massive ocean of information, there's a clear, concise pathway to unlocking the definitive story of every case? That pathway is found in a core set of fields within your tracker, the ones auditors consistently leverage to build an ironclad case. We're not diving into all the data. We're focusing on the critical few that truly reveal what you need to know. These key fields boil down into three crucial perspectives, each vital for understanding the complete picture. First, number one here, you need the financial picture. This isn't just about big numbers. It's about the tangible spend and recovery. Where did the money go? How much was spent? And more importantly, what can be recovered? This is the bedrock of your financial strategy. Then, moving to number two, we look at the coverage context. Think of this as the foundational who and where. What group was involved? Who was the employer? This information is critical because it sets the stage, giving you the essential background before you even get to the dollars and cents. And finally, at number three, we uncover the payment history, beautifully represented by that chain link. This reveals the intricate coordination and relationships. Who paid what, when, and how did those payments interact? This is where you connect the dots, understanding the sequence and interplay of all financial activities and ultimately who is responsible for what. Together, these three pillars empower you to move beyond raw data points and construct a compelling, accurate case story every single time.
Imagine having a crystal clear lens into every dollar Medicare has touched. That's precisely what we're diving into with our financial picture, giving you the granular detail needed to understand, manage, and recover. First, your foundational number, Spend Since Medicare. This isn't just a figure, it's your cumulative, in-scope spend spanning both Part A and Part B. It's the big picture, your primary indicator of the overall financial footprint. But we can't stop at the big picture, can we? We need to dissect it. That's where Spend Since Medicare Part A/Part B comes in. This breaks down that total, allowing you to understand the specific composition. Is it Part A driving the spend or Part B? This insight is crucial for targeted action. But remember, always dive into the underlying claims to verify the true story. Now, here's where the potential for recovery lights up: total spend COB. When you see a value here, it's a critical signal. It indicates the dollars Medicare has paid on coordinated claims, suggesting they may have acted as primary when they shouldn't have. This is often a flashing light, pointing directly to a coordination of benefits issue and a significant recovery opportunity. Then we refine our focus even further with spend_since_prime_EMDT. This highlights the spend after a Medicare primacy date has been entered in the tracker. Why is this so important? Because this is often your most actionable spend, where the rules of primary payment are clearest, making it a prime target for effective recovery efforts. And finally, the ultimate goal, the payoff for all this diligent tracking: expected recovery. This isn't just a hopeful estimate, it's the total potential recovery amount that you can realize if these cases are audited successfully. It's what you stand to gain when you apply these insights effectively. The bars you see on the right vividly illustrate these concepts, visually breaking down these financial segments. They show you at a glance where the significant dollars are flowing and, critically, where our recovery efforts should be focused. This is how we move from ambiguity to actionable financial intelligence.
Ever felt like you needed a decoder ring to truly understand a member's coverage? That deep dive into coverage context isn't just a nice to have, it's absolutely essential for accurate tracking, proactive management, and avoiding costly mistakes. Today, we're pulling back the curtain on the critical components that define exactly who is covered and how within our tracker. Let's start with the foundation, the group NEM. This is simply the name of the employer group, like Target Inc. Straightforward, right? But it's the very first piece of the puzzle, telling us the primary entity behind the coverage. Now, don't just see a number with group NEM or subgroup NEM. These aren't just identifiers, they are narrative indicators. Think of it, a subgroup number can instantly tell you if this is a retiree with no Medicare situation. That changes everything about how you manage their benefits, doesn't it? It provides immediate, crucial context without needing to dig further. And speaking of crucial, look at the key icon next to critical field. This isn't just bold for emphasis, it's truly the linchpin. This field indicates the plan type: active, retiree, COBRA, individual. Why is this critical? Because the plan type dictates eligibility, benefits, and often the primary payer rules. Miss this, and you could be facing significant issues down the line. Next, group size desk. Why does Medicare care if a group has less than 20, 20 but less than 100, or greater than 100 members? Because this directly impacts Medicare's secondary payer rules. Understanding how Medicare perceives the group size is vital for correct claims processing and compliance. It's a silent but powerful indicator. Finally, follower member. This is where relationships become operational data. This field flags when two members are linked: a spouse, a child. This isn't just family trivia. It's invaluable for auditing secondary employer-sponsored insurance or end-stage renal disease cases. It helps us ensure dependents are covered correctly and that complex coordination of benefits is managed without a hitch. This detail can save immense time and prevent costly errors in highly complex scenarios. Each of these fields, when seen together, paints a complete and actionable picture of a member's coverage. They are your toolkit for precision in tracking and management.
Two words that define success in auditing. But how do we consistently achieve them? How do we eliminate the guesswork and ensure every single audit hits the mark every single time? The answer lies in a consistent, repeatable process. And that's exactly what our 3-point audit workflow delivers. Think of this as your reliable compass, guiding you through every case with precision and confidence. Our journey, as you see here, begins with step 1, verify the foundation. This isn't just about glancing at data, it's about establishing the bedrock of your audit. You'll dive into the Basic Data tab to confirm all initial details, and, crucially, you'll meticulously review all case notes. Why? Because the history and context in those notes are often the keys to understanding the whole picture. Without a solid foundation, everything else is built on shaky ground. Once the foundation is verified, we move logically to step 2,
analyze the evidence. This is where you become the detective. You'll meticulously examine the Claims tab, dig deep into NCH data, and trace the path through MSP history. This is where patterns emerge, discrepancies are identified, and the true story of the audit unfolds. We're not just looking at data points, we're interpreting them, building a robust case based on irrefutable evidence. And finally, with a verified foundation and thoroughly analyzed evidence, we arrive at step 3, take action. This is the culmination of your work. Here, you'll clearly document your findings. If a case needs a different set of eyes or expertise, you'll reassign it decisively. And once you're confident, once you've dotted every I and crossed every T, you validate the case. This isn't just a click of a button, it's your professional seal of approval, signifying that the audit is complete, accurate, and ready to move forward. By following these 3 interconnected steps, you're not just performing an audit, you're executing a robust, efficient, and consistently accurate workflow. It's how we elevate our performance and ensure excellence in every single case.
How many times have you jumped into a complex task only to realize halfway through that a critical piece of foundational information was missing or incorrect? We've all been there. That's why our very first step, our bedrock, is to verify the foundation. Before you do anything else, you must start on the Basic Data tab. This isn't just about filling in boxes, it's about confirming the very identity of the case you're working on. Imagine trying to build a house without knowing if the ground beneath it is stable. Here, you're checking those fundamental supports. Does the information here truly align with the specific situation? We're talking about crucial details like Medicare info, those all-important effective dates, and the entitlement reason. And don't forget to verify the group name, its number, and its type. These seemingly small details are often where future problems originate if they're overlooked now. Once you've affirmed the basic facts, you immediately pivot to the Notes tab. Think of this as the case's ongoing memoir. This is where the story unfolds, and you cannot contribute a new chapter without first reading the previous ones. Seriously, read all previous notes. Understand what actions have already been taken, what decisions were made, and why. It's like picking up a book halfway through, you'd be lost. Your notes, when you add them, must be crystal clear, concise, and, crucially, they must justify your specific actions. Leave no room for ambiguity for the next person who picks up this story. And always use the correct Medicare note type before you select Add or Edit. This ensures consistency and proper tracking for everyone involved. So, you've developed your hypothesis. Now it's time to put on your detective hat and dig into the evidence that either confirms or refutes it. Welcome to Step 2, Analyzing the Evidence in Claims. This isn't just about looking at numbers, it's about building a solid case. Your primary workstation for this crucial step will be the Claims tab. For every single claim you analyze, you're going to systematically verify 3 critical areas. First, overlap. Was the member actually covered by both Medicare and the group health plan on the date of service? This foundational check ensures we're dealing with a legitimate coordination of benefits scenario. Next, we look at scope and lag. Is this particular claim within the recoverable window? As you can see highlighted in our example table, we've got clear indicators telling us if a claim is in scope and out of lag, meaning it's fair game, or if it's out of scope due to timing or other factors. This is where we determine if a claim is even eligible for potential recovery. And finally, payment details. What was the paid amount? What was the paid date? Are there any COB indicators that jump out at you, suggesting Medicare might have paid secondary or that adjustments were made? We're scrutinizing the precise financial impact and the timeline of those payments. Remember, this isn't a standalone investigation. As the note at the bottom reminds us, always cross-reference what you find in the claims data with the Spend Since Medicare field and, critically, with the case notes. These supplementary details can provide invaluable context and prevent misinterpretations. This holistic approach ensures accuracy and strengthens your findings before you move to the next stage. Ever found yourself at the finish line of an audit wondering if you've truly tied off all the loose ends, or if there's a crucial next step you might miss?
Well, in step 3, take action, we clarify exactly how to bring your audit to a definitive close, ensuring accuracy and efficiency every time. First, let's look at finalizing your audit. You've done the hard work, identified the findings, and determined the actions. Now it's about documenting and executing. You'll add a final, comprehensive note detailing everything you've discovered and the steps taken. Then you have a critical choice, clearly shown by these 2 buttons on the right. If you need to complete your note entry but keep the case open for further work or review, you'll select End. Think of it as saving your progress. But when you're truly finished, when the case is ready to be closed and your changes applied, you'll select Valid. This is the final stamp of approval, locking in your work. But what if, during your audit, you discover the case isn't even meant for you? This brings us to when to reassign. It's not uncommon to uncover that a case has landed in your queue incorrectly, perhaps requiring a different specialist altogether. Maybe it's an auto claim when you handle health, or vice versa. The reason is simple, a mismatch in expertise. The action, however, is crucial for efficiency. You must reassign it. Don't try to fit a square peg into a round hole. As the visual illustrates, your role is to identify the misrouted case and, using the reassign dropdown, ensure it gets to the right agent. This isn't just about moving work, it's about ensuring the case is handled by the specialist best equipped for it, guaranteeing both accuracy in resolution and overall operational efficiency. It's about getting it right the first time, every time.
In the intricate world of auditing, what truly separates the good from the great? It's not magic, it's a commitment to these 3 core principles for achieving unparalleled accuracy. First, as symbolized by this organizational tree, MSP rules drive everything. Think of these rules not as static guidelines, but as the master key to unlocking correct payer order. The visual here perfectly captures the complex hierarchy, the interplay of entitlement, group size, and working status. Each branch, each connection dictates who pays what and when. Understanding this dynamic foundation isn't just important, it's absolutely critical for every decision you make. Next, we move to Tracker Fields Tell the Story. Look at this dashboard icon. It's a data visualization, not just a collection of numbers. These fields are your early warning system, your diagnostic panel. By quickly zeroing in on key indicators like spend since Medicare or group type CD, you're not just reading data, you're interpreting the narrative of a case. These specific fields are designed to give you an immediate, high-level assessment, saving you precious time and guiding your deeper dive. Finally, and perhaps most crucially, your workflow is your bedrock. This cyclical icon is a powerful reminder that accuracy isn't a one-and-done event, it's a continuous, deliberate process. Your workflow is the engine that drives consistency and prevents oversights. Specifically, we're talking about a rigorous 3-point check. Always verify basic data, your notes, and the claims together. This isn't optional. It's the non-negotiable triad that builds trust, minimizes errors, and solidifies your reputation for precision. Embrace these principles and watch your auditing accuracy soar.
What an incredible journey we've been on together. From the initial challenge to exploring groundbreaking solutions, your engagement has been truly invaluable. And now, as we conclude our formal presentation, there's only one thing left to say. Thank you. Thank you for your incredible attention, for processing these insights with me, and for investing your time in understanding the potential ahead. While the presentation may be complete, I truly hope the conversation and the inspiration have only just begun. Thank you for watching.